Hello, my name is Dora. I'm the refractive coordinator here at the Harman Eye Clinic. Welcome.
So a lot of people talk about the Harman Eye Clinic. Tell me a little bit about the history.
It was funded in 1984, so we have been around for many years.
Our mission is to provide extraordinary care for every patient.
Well, I see you have 3 doctors. How do I know which doctor to choose?
That's actually always a really hard question to answer. All of our surgeons, all 3 surgeons, are excellent doctors, but they all have different personalities. So it really does depend on what you're looking for in your doctor.
Patients come in all the time and they tell me how much they love coming because of the people who work here.
I agree. I feel like everyone has a different personality here, but yet we're all happy in our own way, and
we complement each other really well. You know, the whole reason why we're here is just to provide patients a place where they can feel cared about on an individual level, where their needs are met, where the doctor cares about their eyes, not just their patient number.
I agree, Jess.
This is a very common question. When I'm on the phone with a potential candidate, they are always, one of the questions they ask is, am I a good candidate? Well, the only way to know, to find out for sure, is to come in for an evaluation.
These 4 questions are really important before you do come in for that evaluation, because the doctors want to know how healthy your eyes are, if you have any glaucoma, diabetes, and of course if you're pregnant or nursing.
Then we congratulate you, that's for sure. This is our website, so if you like to take tests, I recommend you take this one. We will ask for your information, but don't worry, we won't sell it to anyone. It won't go anywhere beyond the Harman Eye Clinic.
Our doctors have 2 state-of-the-art lasers that they use for LASIK. They're the gold standard of LASIK, and they're VisX and Intralace. And VisX uses iris registration to do a map of your eyes so that during surgery can track and keep the treatment accurate. And the Intralace creates a flap with a laser, so there's no blades. No blades, and the flap seats back down into position really well. The VisX laser can treat nearsightedness, farsightedness, and astigmatism. It's a custom view treatment that's designed specifically for your eyes, so nobody else's treatment is exactly the same as yours.
Did you know this full evaluation is free?
Picking up the phone to actually schedule your evaluation, it's a huge step. And even the evaluation itself, it's nerve-wracking. I was there. I remember my own evaluation. I remember sitting on that chair just being nervous. Am I a good candidate? Am I not? Well, during my evaluation, I knew I was going to be here for 2 whole hours. I knew I had to be out of my contact lenses since I wore soft contact lenses. I had to be out for 2 whole weeks. And the dilation, I completely forgot about the dilation. You'll be dilated well into the very next day. And it's always a good idea to bring some sunglasses with you.
I love taking patients for LASIK evaluations. It's one of my favorite things because I spend 2 hours with them. I get to find out a lot about not only their medical history, but their lifestyle, their families. I get to help them to get excited about LASIK and understand the process and what the doctor's looking for.
LASIK will not give you the ability to play the violin.
Not necessarily, but it will give you the ability to drive without glasses, be able to play sports, swim without worrying about contacts. There are a lot of things that LASIK can do for you, but you'll have to talk with your surgeon to make sure your expectations meet what it can do. There are no strings attached with your evaluation. You're not required to schedule for surgery. If you want to, though, we can schedule your surgery as soon as we schedule your evaluation date. We could schedule at the end of your evaluation, or we can schedule anytime within 30 days without having to repeat any of the measurements. If you wait longer than 30 days, we may have to repeat some things. We had a patient one time who came in for surgery, and we found out he was planning on going on a cruise and was not going to be anywhere with doctors for a whole month. So we had to reschedule the surgery because of that trip.
We have a list of co-managing doctors on our website, so be sure and look at that, and if your doctor isn't on that list, let us know, because we can what we call co-manage with that doctor in your care, and we'll reduce our fee, which we'll talk about that in a little bit here.
We accept all major credit cards, including Care Credit, which you can apply on our website, 20better.com. And at the moment, it's great because it's interest-free for 24 months, which helps everybody.
To us, your day of surgery is a celebration time. Some things to remember is that you'll be here for 2 hours that day. You'll definitely need a driver. You'll want to take the day off of work, and it's going to be a great day. We're very thrilled for you.
We're finally done with our presentation, but if you have any questions, please feel free to give me a call. I am looking forward to help guiding you through this life-changing experience.